Hi friends, I have the honor of introducing to you Dr. Ayush Goel. He is Rank-2 November 2018 AIIMS, and considering the number of students who sit for this exam, which is like 50,000 plus, it is a huge achievement. How are you feeling today?
I'm feeling really happy, thank you. And I'm actually very relieved that finally the hard work has paid off and now I can relax for some time and then pursue further what I want to do.
And now you have all the choices open to you.
Yeah, that's a
So
great
at
relief.
this rank, you can take anything you want to.
Yeah, that's a good choice to have.
Yes, at least you know that now whatever you decide is your decision. It is not forced upon you by any score or any
Yeah, I
rank.
was just hoping for that only that I get all the branches where I can choose carefully what I want.
Yes. So the freedom of choice comes with the rank 1 and 2. So it's a awesome experience. Awesome, you've done great in this exam. This was like one of the most apex institutes in the country. So to score such a high rank in this exam is commendable. Now I want to, ask you about your journey with DAMS. You joined us in the pre-final year for the
Yes,
foundation course.
foundation course.
So how did that work out for you? You entered raw with no idea about the PG entrance. How did the classes help you at that stage?
I had joined AIIMS in sixth semester for the foundation course. So at that time, most of us do not have an idea of what the PG exam is like and what we need to do. So joining DAMS in that period of time gave me an orientation of what is required to crack the entrance exams. Each subject was given some amount of time and it helps to build some basic concepts which are required, telling us what are the important topics, how to go about the subject, which generally we do not get an idea by just reading books or just attending classes in the colleges. So that idea is extremely important, and that is what DAMS gave me at that moment of time.
Plus, were you the able to make notes for the subjects at that time?
Yeah, so the notes are actually helpful because at the end of when we come towards the end of our preparation, what is important is to revise the stuff in a short period of time, and for that we need to have some good notes, a place where everything is consolidated. So that starts from your preparation time, like from pre-final year when you're making notes of each and every subject, you have a copy which already has everything about that subject, in which you can add on later whatever you're reading new. So that was really helpful, the notes.
So, if I put it in a nutshell that your experience in that year was primarily to orient you to the subjects, give you concepts, and help you understand what PG entrance is all about, and help you make notes.
Yeah, that's true. Like during the pre-final, final year, the main aim was to build the basic concepts of the subject, to gather all the information from places that I want to read, and consolidation part happens in doing an internship.
And probably, I have seen this is the approach that all high rankers have, that usually they utilize the MBBS years more towards building up the things, and internship in a consolidated, exhaustive manner, they go towards testing and revision.
Yeah, because if you see the pattern of the exams also, it tests your global and your basic knowledge as well. That will only come when you have an open-minded during during your MBBS course, when you're reading everything from standard textbooks, from where you're collecting information, and then the consolidation part can be done during the internship.
That was your idea most of
Yeah.
the time. So that is why in internship you selected test and discussion course.
Yes.
And were you happy with the pattern of test and discussion where you have a test followed by discussion?
Yeah, that is actually helpful because you get a week or 2 weeks to study for a particular subject. So you dedicate your time, then you give a test which helps you to analyze how much you have read the subject, and then the test also includes some new questions which might be coming in the forward exams which you might not be able to read from notes or from it. So the updates, you don't need to worry about updates anymore because you know that if there's any new update, that question will be there in the tests. And then the discussions help you to solve your doubts. If you have some new doubts, you can ask them. So it was a good way to like keep moving forward with your preparation, keep analyzing yourself at each and every step.
Yeah, our goal of test and discussion is primarily to test you on the concepts that you know. Plus, we want to give you updates because many students who have done foundation with us, they repeat in the test and discussion with us. So we want, in the world of medicine would have changed in the preceding 2 years.
Yes.
So we want to add those updates there. And even in the same, you had a question even on that recent Nobel Prize as well.
Yeah.
So you never know, the exam body might focus on some new updates. That is in addition to the basics, there are always one or two questions which are very recent or very current in their thought process. So that is what the course does to help you.
Yeah.
Did you by any chance give the CBT exam that we conducted?
Yeah, I had given the CPT exam to get a experience of sitting in a particular place for 3 hours and given an exam on the computer screen, and I had got 19th rank. So it was a good experience telling us how to go about things, how to manage your time, how to operate. Because it might happen that if you're not given any exams before, you might just panic on the exam day. So it's important to have an experience beforehand regarding giving a computer-based test.
And did that 19 rank give you confidence that you're on the right
Yeah,
direction?
because you know that there are so many people who are giving this exam. So if you're standing well, it motivates. So that gives you because if you get a good rank in the CBT or any grand test for such, so it gives you the confidence that yeah, you're on the right track. You just need to keep moving forward at the same pace and you're in the right zone. It just motivates you further. So in that way, it's extremely important to give in tests beforehand.
And I would like to emphasize that the giving tests has its own importance, because sometimes students who do not give tests, they don't understand how they would think on the day of the exam. And that is where the confidence also comes. When you are able to perform in a exam environment, that gives you confidence that okay, I'll be able to do it in the real exam as well. So I think that works.
Yeah, that works because there are so many aspects of giving an exam. It's about time management. It's because every exam you give, you'll find certain questions which are never heard of. So you don't know how to tackle them. When you're given multiple exams, every new question, you get an idea of tackling them, because some of the questions can be answered by just looking at the options, which will only happen if you have given enough number of exams. So that the final day, it's nothing new for you. It's just a normal, it's like any other practice exam that you have given. We'll get new questions and you have the arsenal to tackle them. So you have to give exams beforehand to practice.
Now, may I ask you, we're talking about exam strategy. How many questions did you attempt in this AIIMS?
I had attempted 196 questions.
Which is good, right?
Yeah.
So when you saw the paper, you saw the topics in the initial, 15-20 minutes when you were doing the paper, did you feel that I need to be more aggressive? Did you start telling yourself, or you went about with your instinct that okay, I'll do whatever I'm able to do? How did you manage
initially
it?
I had a plan of attempting more than 190 plus questions according to my seniors, which is required. But after I started doing the paper, it seemed to be like more approachable. This paper was more approachable as compared to the previous May paper, which was like a bit more atypical. But this one, like, you felt that you could attempt a lot many more questions. So I was a bit more aggressive with it.
And I want to tell all the candidates appearing for future exams, if you see an exam which is doable, you have to tell yourself it is doable. Not only for yourself, it is doable for all your competitors as well. You have to go aggressive. If by any chance, if he had stopped and held back at this exam, this rank 2 would not have been possible. You have to go aggressive, because this exam in particular, I think if I compare it with the previous 2-3 AIIMS, 4 AIIMS, this was more doable. What do you think?
This was definitely more doable as compared to the previous papers. And yeah, looking at the paper, you could say that everyone is going to attempt a lot because everyone felt that they could do it. So it's important for you to also be on the aggressive side and attempt a lot many more questions.
And did you feel the time pressure in this exam? Like, were you able to finish in time, or you were able to revise in time?
Yeah, I was able to finish in time and revise. That happens because you know how to manage your time by giving previous exams. Like, I'd given many mocks, so I knew how to manage my time. So I knew that what was my goal and how much time I need to finish my questions, how much time I take to like revisit the questions I want to revisit. So that will only happen if you keep giving exams.
Yeah. And this AIIMS, I have also observed that none of the rankers has talked about time being a tough factor in this exam. But mind you, in May AIIMS this year, the paper, the questions, the choices were more tricky, and everybody took more time, and it was tough to finish the paper. And some people who had marked too many for review, in that exam it was a big factor. But in this exam, I think everybody was able to revise everything, look at all the things they have marked and save it neatly and cleanly. And I think that is what the repeat topics do. There were some repeat topics, so that makes it easier to hit. So they take less time, and then you are able to divide the time.
Yeah.
But time management is a issue in AIIMS exams. This time it was not, but don't think that in May it may not happen. In May last year, they surprised a lot of people with the May AIIMS exam.
Yeah, it might be a problem any time. So you need to be prepared for everything.
Yes. And what about the topics? How would you assess this AIIMS exam in terms of the topics distribution? If you're explaining to a future aspirant who has never given the AIIMS, what was the stressed upon points in this exam?
Like anyone who has seen the previous year's paper, this paper was almost in a similar pattern in such that the basic clinical sciences always have more importance. Like almost 100 questions can be filled up with the first and second year subjects along with PSM and then Obs Gynae as a whole. So we cover almost like 100 to 120 questions is done in these 7-8 subjects. So any aspirant has to focus on the basic clinical sciences because the last time we read them was in first and second year. We have a 2-3 year break and then we come back to these subjects. So it's very important to read these subjects And then the clinical ones definitely have their say. But even in the clinical subjects now, like if you see medicine, it's more towards emergencies. They're not going into hardcore medicine like valvular diseases and hardcore topics. So more about the general topics like emergency. Even in surgery, more about the general things like instruments, catheters, cannulas. So the focus is definitely on the emergency as well as the general aspects and basic clinical sciences. And if you see the paper, that this year paper had a lot of repeats, like direct questions without even changing the options were a part of it, like at least 10 questions if I remember correctly. And if we see the topics, then definitely topics get repeated in AIIMS exam. So it's important to do the previous year's papers, read the topics, read the options, and then read around the topic. Not just that, but around the topic is also important.
Did you utilize the May AIIMS discussion that we have put on the eMedicos?
Yeah, I utilized the May AIIMS discussion put on eMedicos. So that was a good thing, because if a teacher is explaining a particular question to me, I need not worry about the answer first of all. I don't need to question it. I can accept what is given, and I'll trust the teacher that he will cover whatever is surrounding the topic as well. I don't need to go run behind the topic and read it from somewhere else. I can just trust that whatever is around the topic has been given to me. So that makes it very easy at one place. So you can just do it.
And now we have even the PGI and the JIPMER paper available on the app. And one thing I would like to add here is, as a teacher, another value that we bring to table is sometimes in a AIIMS exam, there is one question which is like very tough or very absurd. And as a teacher, I know they will never repeat it. So when I'm discussing, I'm able to tell this. Otherwise, what happens is when you're doing that question from a guidebook, what happens is you may not know that, this is from my, as a clinician point of view, I feel that is absurd. But I am able to tell you that, okay, they have asked it once, they will not ask you this concept again and again. I don't think they should. But what happens is, if you are randomly doing it, you might, spend hours into researching onto that topic, which is actually not a relevant topic. Sometimes it happens.
Yeah, that's actually true, because if we see the previous year papers, so whatever gets repeated is mostly the general things. The absurd things don't tend to get repeated.
Yes.
So there's no point banging our heads trying to find out about the absurd things.
Yeah. And I also want to know that we had an emergency medicine mop-up on the app, and I also feel that emergency is important part of the exam today, and infections emergency put together, basic sciences, would make the chunk of the paper into
infections and emergency are basically the chunk of medicine and micro combined. So we had both the mop-ups on eMedicos available. The emergency medicine mop-up had some 4-5 question papers with their explanations later on. So that was a good way of analyzing yourself by giving the test first of all, and then seeing where you're faulting, and then reading up your topics. So you know what is important. The main thing about PG preparation is to know what you're supposed to do. And if someone's telling you what you're supposed to, that's the best thing forward.
And another thing that I feel is that, if somebody is targeting May AIIMS, you can, add things and, let's create something for somebody who's, so, you can begin by flipping through last 3-year AIIMS papers. We have put them on the ebooks app as well. You can just flip through them. You will get a hang of it. You'll get a feel of it. And okay, this is where I'm going on. If you have not done well in this November AIIMS, do a strength weakness analysis.
Strength weakness analysis is the most important thing. Personally, I did it like after my DVT session, like I had 2 months in hand. So you need to know what's your strength, you need to know what's your weakness. There's no point just building on your strength and forgetting about your weakness. You need to work on your weakness more than your strengths.
So were you able to identify some weak topics after the DVT session?
Yeah, because DVT, like in 3 days, you get like all the subjects, almost all the topics. So you can just sit during the DVT sessions as well and just see, this topic I'm not sure about, this topic I've not read, this topic I'm pretty sure, I'm confident. So you can have a list of all the subjects, so you know what you're supposed to do in the next 1 month. And after like doing the previous year's papers, you get a hang of the subject as in you know what is going to be asked. Every subject has its own hot topics which are asked multiple times. So if you're missing out on those topics, then you are at a loss. So it's important to at least have those hot topics in your hand and then read. If you have extra time, you can read around it.
Did you enjoy the DVT session?
Yeah, the DVT sessions were nice because like in 3 days, if you get a feel of all the 19 subjects and look at a lot of images. So first of all, there's a pictographic memory. If the image just comes, even if you just remember a bit of it, it's fine. It's fair enough. So DVT is good because it gives you a feel of all the subjects in 3 days.
And if I may ask you, like any new thing that you feel that a future aspirant should focus on, anything else that you feel that if you were to give the May AIIMS exam, what extra would you do other than the topics that we talked about?
Previous year's papers are definitely important, and then in surgery again, cannulas, they have stretched it to catheters, now the color of catheters, so anything around those topics becomes more important. Instruments are coming up. I don't
Chest
know,
tube,
chest tubes, yeah, all the tubes. I don't know why they're asking a question on electron microscopy images every year, that too, especially
Yeah.
of nerves. But
Usually,
the thing
some
is,
persons interest you
yeah, but
comes.
the thing is, we need not worry about the video-based questions because most of the videos, if we see, were actually pretty easy. The questions were not supposed to be answered based on the video. It was supposed to be answered on the basis of the question itself. The video was just a compliment. So
Yeah.
there's no need to like worry about the
I
video.
personally felt that they made the question more easy by you have a video also now it makes it
Yes,
more
it
easy.
makes it more easy.
Yeah. And now, I want to now put you into a corner and I want to ask you like you are a high achiever, you're a rank 2 in an exam where people aspire to be in your position. So, what makes you so successful? Like, what is it that, what is the personality trait that you have? Maybe, somebody would have hard work, somebody would, what do you think makes you reach the position that you have reached?
I think first of all, it's about clarity. You need to know what you're supposed to do. You need to know what you actually want. Like, first of all, it's PG or USMLE. You need to know what you want to do. Secondly, you need to have an orientation towards it. So that I had a clarity of thought that, yeah, this is supposed to be done. You need to know yourself and like what are your strengths and what are your weaknesses. That reality assessment is extremely important so that you can address your weaknesses and you can build on your strengths. So I personally feel that, yes, I had a good assessment of what I'm capable of so that I could work on my weaknesses. And then, yeah, dedication is extremely important. So I feel that, yeah, I always knew I wanted to achieve a good rank over here and pursue forward. So that dedication is important. And the next thing is, that's it, I think.
And with that clarity, I want to ask you a question that many rankers want to know from you. Which branch do you want to take?
I will opt for general medicine.
So most likely he's going to go for general medicine. He's still contemplating, but most of he's already kind of focused on medicine. So people behind him in the rank are like many of them keep asking me. So I said I'll ask this question in the interview itself. And I also want to know from you, like if I ask you today that like say something which would motivate other people to do well, will you be able to say something, or you want to say something that you feel that okay, this is something somebody should have told me, I want to tell other people?
I think the most important thing is to have confidence and faith in yourself. Whatever happens, you should not lose hope. It's important to just keep moving forward. Everything's gonna fall into its own place. Have a good bunch of friends who keep motivating you and supporting you, and just trust yourself and keep moving forward. You'll do it eventually.
I think it is his clarity of thought and confidence that has always helped him. I think because when I talk to him, I come across somebody who's very clear about what he wants and what he doesn't want, and that clarity helps you to stay clear of the clutter in the exam. Also, what happens is if you're very all jumbled up in the mind, you will make silly mistakes. If you're clear, you will not make silly mistakes. So that clarity you have to work on. Some people have it innately, some people have to work on. So don't panic if you are a little overthinker or underthinker. You practice. You have to tell yourself that okay, I'm overthinking into it, I'm underthinking into it, so that you can become the clear person who can approach things in a simplistic manner. That is the goal. Now, any particular teachers that you want to thank or mention today that impressed you in DAMS during the classes? Any particular
Like,
teacher?
I think everyone who has attended DAMS would obviously want to thank Sumer sir and Deepti ma'am.
It's my honor.
Especially like Deepti ma'am, she teaches really well, and her notes are like, they are just awesome. You don't need to look beyond anything in Obs Gynae other than her notes. And other teachers like Arvind sir, I personally liked his class a lot, the medicine class that he took. So they were all like quite motivating, quite interesting.
And probably you wanted to do medicine also, though maybe that also.
Yeah,
works.
that was.
I have always seen people who want to do medicine, they would mention Arvind. People who want to do radiology would be more happy with me. That happens. So with that, with that note, I also want to take this opportunity to congratulate your parents, your family for this exemplary achievement that you have done. I'm sure they would be very proud of you. I wish you all the best. Heartiest congratulations.
Thank you so much.
Congratulations.